So what we're looking at here is we are looking at the sternum. The sternum. This is the midline front portion of the thoracic cage. So the sternum is a singular bone divided into three parts. Okay, we got an upper part, we have a middle body part here, and we have a lower part. So this upper part here, this is called the manubrium. The manubrium. This middle part here is called the body, and this point down here is called the xiphoid process. These are all things, all parts of a bone that you can palpate on yourself. You can feel the manubrium, namely this part right here. This is called the jugular notch. The jugular notch. Okay, you can feel the body, and then you can feel the xiphoid process. The xiphoid process. That's the point. That's that pointy, sharp thing at the bottom of your rib cage. Of the rib cage, of the sternal structures, these are probably the most significant. These are the costal cartilages. So what you're doing is you're looking at the cartilages that come off from the ribs before they actually connect to the sternum itself. Notice here individual costal cartilages. Okay, when you get down into this area here, you can see that a bunch of ribs join one single costal cartilage. What that does is it sets up true ribs and false ribs. True ribs and false ribs. So the first 1, 2, 3, 4, 5, 6. Some people may say 7. So the first 6 or 7 ribs are true ribs, in that the rib comes off of the spinal cord and then it moves down, becomes a cartilage, and that individual cartilage joins the sternum. That's what makes it a true rib. You get a one rib to a sternal attachment. Then when you get lower down here, you can see a bunch of ribs, a bunch of costal cartilages come together to a single costal cartilage and then attach to the sternum. That is a classification of a false rib. Okay, so true rib versus false rib. Then we have floating ribs, which are ribs 11 and 12 across men and women. Those are what's called floating ribs. They don't have a costal cartilage, and they do not wrap around the body. They don't wrap around the body themselves. So ribs, the general rib structure is this. Okay, they're really flimsy bones. They're really flimsy. There's not much to a rib. Okay, but you do have to know what's anterior and what's posterior on a rib, and if it's right or left. And the way to do this is, if you look at this part right here, this portion right here, this is a flat portion. So if you follow it here, it's flat. There's nothing here. This is where the cartilage would attach right here. So this is always anterior, always anterior. So now you got to ask the question, so would it be anterior like this, or is it anterior like this? So how is the orientation? The way to do that is to feel the rib. Feel the rib. So the top part of all the ribs, they're curved. They're curved. They have nothing. So there's nothing there. Very smooth structures of the ribs. So what you do then is you feel the top. So if it's flat, if it is rounded, that is the superior portion of the rib. You can also feel the bottom portion of the rib, and you can actually see it right here. You can see there's a groove here. There's a groove here. And it's actually got a fine line. It's actually a sharp line. That is always inferior. And what this groove is, you have arteries, veins, and a nerve. They all run in here, in every rib. So they are posterior. Sorry, they are inferior. The head of the rib here is always posterior. It actually articulates with the vertebral body and the transverse process here. So this is what the structure of a rib looks like. I'm not going to make you identify individual ribs except for this one, rib 1. You have to be able to identify rib 1 because he looks totally different than all the other ribs. Okay, most ribs are thin. This guy is, well, he's thin this way, but he is wide. He has a very distinct neck. This makes the very top of the costal cartilage themselves. So rib 1, you have to be able to identify rib 1. So just look at its appearance and just memorize what it looks like. This is the only one I will ask you, which rib is this?